I was first diagnosed with TMJ disorder when I was 14. By the time I was 29, I had no choice but to have surgery. 5 years after my first jaw surgery, I am in constant pain. I find myself gasping for air. I went to Dr. Hang. I quickly learned about his passion for facial balance as well as open airway. He determined that I should go see Dr. Wolford in Dallas, Texas for another jaw surgery.
I've been involved with doing orthodontic surgery cases for 38 and a half years of my life. I have a practice in which I treat lots of chronic pain patients, some of whom have had very long history of pain and history of lots of treatment, which has been unsuccessful. When I first saw Trish several years ago, I'd seen the treatment that she had. She'd had jaw surgery done already, and I wasn't pleased with what I saw. Her upper and lower jaws were not forward properly where they should be, and I knew that her airway was very poor. She has to have something done about it, or she will not enjoy a normal lifespan. So what Trish needs to have done at this point is a total joint replacement. Dr. Walford is probably one of the most important people in the world in terms of developing new ideas with orthodontic surgery. I love it when the patient comes back and says to me, they woke up and they were in the recovery room and they said, I can breathe, as if they never had before. That's what I hear when my patients come back from surgery with Dr. Walford.
Tricia has a very interesting problem going on with her jaws and her jaw joints. She has a condition in her jaw joints called psoriatic arthritis, which has caused destruction within the jaw joints themselves. With destruction of the jaw joints, it causes pain. In addition, because the jaws have become retruded, it also has caused some airway problems. The jaw joint is made up of three basic parts. There's a lower jaw part here, right here, that's called the condyle, and it sits up in the socket. Then between the upper and lower jaw, there's a little piece of cartilage in here. It's sort of like the cartilage in your ear. It's very flexible normally. And it's attached onto the lower jaw and sits right between the upper and lower jaw structures. Now what's happened is this disease process has affected the tissues inside the joint here and is causing destruction of this disc. In addition, it's slowly causing breakdown of the bone structures here, and the bones are slowly resorbing away. And so this has the effect of causing the upper and the lower jaw to start shifting backwards slowly but progressively until we're in the situation where Tricia is right now, where she has the retreated upper and lower jaw. Again, what this shows, it shows that the upper and lower jaw are retruded. They're back under further than they should be. But in addition, back in the back of the throat here, where this dark area is here, this is the airway. And your airway dimension here is very constricted. In fact, right here, this whiter area back here is the back of her throat, and then this area right in here is the back of her tongue. She has about a 3 to 4 millimeter airway space in that area there. The normal dimension is 11 millimeters, and it can cause a lot of other medical problems such as high blood pressure. It can predispose people to strokes and all sorts of medical conditions, heart attacks, things like that. So one of the objectives that we have when we fix Tricia is to actually open up this airway as well so that she will have a normal airway dimension. The technique that works best to correct her joint situation is to use artificial joints. We get a CAT scan, and then a three-dimensional plastic model of the jaw structures is made. What I would do for Tricia is I'm going to bring her lower jaw forward, just as I did on this model here, so we can open up her airway and improve her facial balance. She will need artificial joints on both sides, and this is what an artificial joint looks like constructed for the jaw joint. Now for Tricia, what we're going to do is we're going to bring the lower jaw forward. advance it forward to where it should be if she would have not developed the jaw joint pathology. And so the lower jaw is going to come down like this, and then that joint prosthesis is going to be made to hold that lower jaw forward into that new position. This is a tracing of Tricia's profile the way it is right now, and you can see how the jaws, both upper and lower jaw, are rotated back under, sort of back up in this way. You can see how narrow the airway is at the very back of the throat here. And what I've done here is I've taken the lower jaw and I've advanced it forward. We're going to come forward about 15 millimeters, a little bit over ½ an inch. And we're going to do that with the joint prostheses back here. That's how we bring the lower jaw forward. Then the upper jaw is going to come forward about 8 millimeters at the front tooth tip. And that's going to reestablish good facial balance for Trish, besides open up the airway at the back of her throat, so she'll have a normal airway to breathe through afterwards. There you can see the changes that have occurred. Tricia's chin is right here where this red line is, and it's going to come all the way out to here. The upper lip is back here where the red is, and it's going to come out to where the blue is. So as we bring those jaws forward, it's going to make a tremendous difference for Trish relative to her airway, her comfort. It should eliminate her pain problems, get rid of her headaches, and allow her to eat, talk, and function relatively.